The Help Nagaland Breathe campaign is basically a voluntary initiative. We are not really an NGO, but we are just a coming together of friends we would like to call. And this was started during the second wave of the pandemic. And during this time, we felt that we wanted to reach out to our people, and that is how the campaign came about. We have come to a successful end of the campaign, so we would like to think that the campaign has been successful, and through this press conference we want to thank our donors, our well-wishers, our support NGOs, and also this campaign has been a success because of the faith and the trust that all of them have placed in us. So through this platform we want to divulge the information, our financials, the distribution of the medical supplies that has been carried out, the money that came in, how we have come to a decision in sending the supplies to different parts of Nagaland.
Help Nagaland Breathe was started back in the month of May 2021. All the dates and stats are in the booklet, so you can just have a look whenever. So Help Nagaland Breathe started because of the situation that was in Nagaland. A group of us, we got together, we were discussing about the situation in Nagaland, and we thought, oh, can we do something? The government is doing a lot, the churches are doing, communities are getting together to help the patients and the health centers. And so we saw the opportunity that there were donors, international organizations, aid agencies providing supplies, and we thought maybe we could connect them with the health centers back at home. And that's how we got together. Initially it was just a couple of us, but then we were very fortunate to receive the support of a lot of donors, and a lot of medical aid started pouring in for Nagaland. So very briefly, we so far raised, in the campaign ran for 7 months, from May to November. We had 45 plus volunteers, Nagas based in about 7 countries. We worked in different time zones. All the project was done virtually. All of our weekly meetings was done online, which was very fascinating. And at the end of this campaign, we distributed medical supplies to all the district hospitals in Nagaland, including NHK and referral hospital. We distributed medical supplies worth 1.5 crore. We received financial aid, about 25 lakhs. And we could do this because of the support of over 20 donors from India and overseas. And we were also supported by the local government to transport some of the supplies. We had Pro-Rural, which is a non-profit based in Nagaland, who was our fiscal sponsor. So they helped us manage all the finances. We also had YouthNet, who helped us with the logistics. We needed warehouse in Kohima and Dimapur to keep the supplies. So storing our supplies was done at Pro-Rural and YouthNet's office in Dimapur. So that is how we functioned. We are really grateful to all the international donors as well as national donors who kind of generously provided supplies to the state of Nagaland. We also started a Milap campaign, which is a fundraising campaign online, and we shared it to our friends in Nagaland, India, and around the world. And through that, we received so many generous donors coming online to support us via the Milap campaign. So through the humanitarian agencies and through our Milap fundraising campaign is how we raised all the donations for the 45 plus health centers in Nagaland. Throughout last year, from May until November when we functioned, we made sure that every time we were confirmed of a consignment of a donation, we put it up online, and then the tracking dates, everything was made up online until they reach the beneficiary. All the information will be available in our website just to make sure that it is transparent. In terms of what Nagaland needs, what are the gaps in Nagaland, that was one of the greatest challenge. So 5 of us, we were part of different working groups.
Districts. And I think each district we had to supply differently. As in some districts we had to supply it ourselves. We had to hire private transportation, and we had to spend it from the campaign funds. Some districts, the administration provided vehicles. Some districts, the chief medical officer's office provided transportation arrangement. And I think there was also a district where the MLA had paid for the transportation. So it was not like a one-size-fits-all solution. It totally depended on the district and the beneficiary. For us, Zapu and me, we are the lead at the logistics team. So as the logistic leads, it was our responsibility not just to deliver the supplies, but we had to also monitor the supplies and also make sure that the supply, we had to collect the acknowledgement receipts. So it was not just sending the supplies and just like forgetting it there, but also following it up, making sure the supplies are working, and also getting receipts from the beneficiaries. And also we had to create a database. So we had created a database from scratch on the Excel sheet, and monitor and track every item that was sent to every beneficiary. I think we had tracked. We did not miss any item. So I think that was a very big challenge in creating a database and maintaining. Eventually we reached out to, I think 45 beneficiaries. And I think there were around maybe 15 to 20 different items as well. Right? So so that was a big challenge. And the problem was there was too many, I don't think it was like for some beneficiaries, we would not just send it at one go. So there were linkages, so we had to send it through the police, and then the police had to send it to the administration, and then from the administration, the district, the block level, they had to send it to the village level again.
I think initially we had to use our individual credentials. So the core team members, we had to put our name out there, and we were accountable for what we were proposing. We had done a thorough research of the healthcare infrastructure in Nagaland, and so we have the stats. Some of the numbers are open to the public domain, and some of them are not open to the public domain. But we tried to find the information of the current situation. We used that data in addition to the reports made by different news outlets as well as research institutes in the world. They were reporting on the projected number of cases in the Northeast, and so we used that data to develop a strong research proposal. The second thing we did was we collaborated with local NGOs to make sure that they were there to help us with anything finance related. We have our legal friend here. She handled all the MOUs with the organizations. So any kind of financial donation that we were expecting, it came to the local non-profit that we collaborated with.